My name's Cassie Carpenter, and this is my final group presentation with Allie Coneybear, Nina Wartell. So, the history of gambling addiction. Gambling is the most common impulse disorder worldwide. This means that it stimulates the brain's reward system, much like drugs and alcohol, which is what makes it so addicting. And the history of gambling addiction itself is really hard to find because no one really knows how far addiction goes back, because a lot of people didn't call it addiction, or they didn't really know much about it. So I found a lot of history on gambling itself. So it was first seen in ancient China around 2300 BC. It was believed these tiles were unearthed, which appeared to have been used in a lottery type of game. The Chinese Book of Songs makes a reference to the drawing of wood, wood being these tiles that were unearthed, which suggested that the tiles formed this rudimentary game of chance. The earliest gambling houses, which kind of resembled casinos, started appearing in the 17th century, mostly in Italy. In 1638, the Ridotto, which means private room, was established in Venice to provide a more organized gambling environment. Because there was so much chaos during the annual carnival season that people wanted to have their own private room, which is why the Ridotto was originally created. Gambling addiction itself was studied by Dr. Robert Custer, who treated pathological gamblers and wrote about this illness, as he called it, for a lot of years before anyone recognized his teachings. It was first recognized in 1980 when it was added to the DSM, and it was mostly due to the efforts of Dr. Robert Custer. Gambling has progressed tremendously because technology is an up-and-coming thing, and you can do so much with all the devices around you. So people have chosen to gamble using their digital devices over in-person casinos because it offers more convenience, because you can just whip your phone out of your pocket. It's easily accessible. Just go on the internet or find an app. And people can hide behind a screen, so it offers a sense of anonymity. No one knows who you're actually dealing with. Technology is just constantly with people, so the impulse to gamble is constantly there, which makes gambling addiction so much harder to overcome when you can gamble with the device that's in your back pocket. So gambling statistics. Gambling is about a $40 billion industry right now in the United States. I actually found a source that said it costs over $6 billion. It costs the U.S. economy over $6 billion a year to put up with all the gambling debts and people who get in trouble for illegal gambling. And approximately 10 million people have a gambling addiction at this moment. About 1 in 20 college students fit the criteria for a compulsive gambler. College is where kids are first introduced to gambling a lot of the time, and there's a lot higher rates amongst college students. So my next fact is actually that it's more than double the rate of the overall adult population.
I will now be talking about how gambling is addicting. So, first, I will be talking about how gambling slowly turns into an addiction from beginning to end. Gambling for some people is just like drinking or drug addiction for others. Gambling changes the individual's mood and state of mind for that brief period of time. Gamblers then continue to gamble to feel that same effect they felt before, which then leads to an addiction. They feel that same sense of high as other people struggling with addiction feel. If a gambler loses their money, they will not stop until they win it back, which then turns into a vicious cycle of constantly chasing that feeling of a high that they crave and chasing the money as well. Next, I will talk about the scientific or psychological reasoning behind addiction. Gambling can affect an individual psychologically because, according to Tim Newman, people who live with this addiction may experience depression, migraines, distress, intestinal disorders, and other anxiety related problems. People with a gambling addiction either gamble because they are in desperate need of money, like the feeling of the thrills and highs you get when gambling, which is winning money, or even the atmosphere that is surrounded by the gambling world. When gamblers are winning money, this releases dopamine in their brain, which then activates a reward system in a way. Dopamine is known as the feel good neurotransmitter. People who have lower levels of serotonin and make more impulsive decisions are more prone to becoming addicted. When gamblers are constantly being reinforced for their actions, they will continue to do it because they are physically winning money and also being reinforced with the sensation that dopamine makes them feel. It is also proven that people who have a gambling addiction are more prone to having other addictions such as drinking and drugs because they are constantly trying to feel that thrill and high that they are getting from gambling. Next, I will be talking about brain functions, financial reasoning, and environmental factors that play a role in gambling. When being placed in the same environments as other gamblers, this makes it easier for the gambling to keep happening and occurring. Gamblers might not think that their actions are harmful, and they might not even notice that they have an addiction problem. It is also proven that individuals from lower class families or neighborhoods are more likely to become addicted to gambling than someone who is from a higher income family or neighborhood because these individuals are in more need of money. Next, I will be talking about the cons of gambling. So, I will be discussing the how gambling leads to financial problems. So, when gambling, people will lose large amounts of money, which then they try to win back. Gamblers will continue to play large amounts of money, which majority of the time they cannot even break even with their losses. Some financial problems that may occur would be overdue bills, maxed out credit cards, and denial of credit, always short of money, and they cannot provide for basic needs such as food, clothing, shelter, and much more. Gamblers believe that money is both the cause and solution to their problems, which makes it even harder to quit this vicious cycle. Gamblers will go as far as even selling their house and very valuable items to use for gambling or to live off of because they lost the rest of their life savings gambling. Next, I'll be talking about how gambling leads to relationship problems. Many people who are friends or family members of gamblers start to develop a difficult relationship over time because these individuals who are gambling will oftentimes ask to borrow money, steal, or break the trust that was developed in the relationship. When it comes to romantic relationships, an individual may find it difficult to trust the gambler because of money constantly being spent and possibly stealing from the other individual. Gamblers might not think so, but their addiction may affect everyone around them, which then could lead to isolation. Isolation could result in the gambler having no guidance or help to get out of this vicious cycle. Gamblers might also start to withdraw from family events to put their time to quote unquote better use in their mind, which can break apart relationships over time. Finally, I will be talking about how gambling leads to mental illnesses. Like I mentioned before, gambling can lead to depression, migraines, distress, intestinal disorders, and other anxiety related problems. According to Rick Benson, many people will gamble as a way to distract themselves from their anxiety or channel their anxiety into the excitement they get from gambling. Up to 34% of problem gamblers also experience extreme anxiety in the form of post traumatic stress disorder. Some other thoughts or issues that can happen over time could be that the gambler might feel hopeless or helpless or despairing. It is hard to think and to remember things, and your thoughts seem slower, and you go over and over guilty thoughts, and you also can't stop thinking about certain problems.
To start out, I just wanted to mention the 3 treatments for addiction, and those are psychotherapy, medicine, and support groups. And on the right, I put an image of the Gamblers Anonymous logo, which is just like Alcoholics Anonymous, but for gamblers. Next, I found on Addiction HQ 15 steps to successful gambling addiction treatment. The first one being have a real conversation with the addict. Listen to them carefully and don't show any judgment. Next is get to the source. Money and financial troubles is the most common reason that people begin gambling. So you got to figure out, is there financial trouble or is it a result of something else? 3, addict must admit to their addiction. Patience is important. You can't fix a person if they don't want to fix themselves. So you have to be patient and let them wait until they're ready to fix themselves. Next is counsel the addict. This should be done professionally. And empathetic, straightforward approach should be taken. 5, come up with a treatment plan. And there are 3 ways to treat. Again, psychotherapy, medication, and support groups. So you kind of have to pick and choose between those and figure out which one is the best treatment plan. Medication isn't for everybody, and so support groups might be what helps. Medication might do absolutely nothing to help someone. It all affects people in different ways. Single out the sources of the addiction. Financial strain is the main reason again. And on the Addiction HQ website, it talked about the insula, which is a part of your brain. It said when this region of the brain becomes hyperactive, thought patterns can be distorted. Also, with this condition, the brain can actually trick the addict into thinking that they just missed a win. So, singling out the sources. Is it that our brain tricking us? Is it strain from finances? Figure out the source and try and get rid of it. 7 is convince the addict of the invalidity of sources. They need to know that gambling won't solve the problem, and they need to know that there are other more productive and not addictive ways to fix their problems, whether it's an illness, a mental illness, a mental disorder, or financial instability. 8, motivate the addict to change their ways. In order to do this, you have to show empathy and compassion. It'll push them to get treatment more than judgment and anger, and I've experienced this personally. The empathy and compassion is a huge thing when it comes to helping an addict change. 9, demonstrate incentives of giving up gambling. This is more like you want to talk about the good things that come after addiction, because good things do come from after addiction. It's not always you end up on the street, homeless, no job. You might end up being no longer being addicted and finding a way to fix your income, pay off bills, and create good relationships with family members after maybe years of not having a good relationship because of your addiction. 10 is avoid conversations about games of chance. and this is basically saying don't replace one addiction with another. Don't tempt the addict. Tempting them makes everything you've done irrelevant. So don't relate their addiction to another addiction. We're trying to eliminate it, not keep it around. 12. Emphasize productive tasks. This is when you want to tell the person what they gain and not what they lose. You want to encourage them to do things such as volunteering or keeping a journal to kind of keep their mind on something. And if you're a journal and you need to write, you're having a bad day, you need to, you feel those urges to go gamble, write in that journal, or go down and do some volunteering at a food shelter, or whatever it may be. Just productive tasks to keep your mind off of the impulses. 13. Suggest hobbies or occupations. You should find hobbies of the addict and encourage them to use those kind of as an outlet whenever they feel a need to go to the casino and gamble away all their money. Maybe they go fishing instead, or art, or hiking. Anything that is somewhat of a hobby to them, you want to suggest those. And that's another thing. It distracts the mind from the impulses. The last one is maintain treatment. Maintaining treatment is staying connected to the addict and continuing to encourage them. If you don't continue to encourage them, more than likely they will fail. They will relapse. And in the event that they do fail, you can't give up on them. Because once you've gone through the process of all of these steps, you've established this rapport with this person, this respect, this close connection, the trust. Giving up would just send them right back into relapse. So you need to stay connected, check up in on them, make sure they're doing okay. Maybe, hey, let's go get coffee or something. Just to make sure that that person is still on the right track. Because obviously you can't do everything, the addict has to do it too. Okay, so following those 15 steps, I have a few facts that came from Psych Central. And Psych Central says that 50% of gamblers have a mood disorder, 60.8% have a personality disorder, 75% have an alcohol abuse problem, and 38% have a drug use disorder. All of these are kind of intertwined, and the reason medication is one of those ways to help addicts recover is because it controls impulses, and impulses can also be part of, obviously, alcohol abuse, drug abuse, personality disorders, mood disorders. But medication, again, doesn't work for everyone. Sometimes it's the support groups and the therapy that does what needs to be done. And then on the side, I just put a picture of the most common mental health disorders, since they were relevant in at least personality disorders, mood disorders. They were relevant within the gamblers, especially mood disorders, that 50%. And that is all.